So we have another eye model. What we can see externally so far, we have our lacrimal sac over here, which leads down deep to the nasal lacrimal duct. We have a couple muscles here. We have 6 of them, 6 extrinsic muscles. You have your superior rectus, which moves the eye superiorly. You have your lateral rectus, which moves the eye laterally. Inferior rectus, which moves the eye inferiorly. And then your medial rectus, which moves the eye medially. And we have 2 oblique muscles. You have your superior oblique, which doesn't exactly attach to the eyeball directly. It attaches to the trochlea here, as you can see, which then attaches to the eyeball, which moves the eye inferiorly and laterally. You have an inferior oblique, which again attaches directly to the eyeball though, and moves the eyeball superiorly and laterally. Back here you have your optic nerve attaching directly to the back of the eyeball where the optic discs meets. Back here you can see the optic chiasm. We'll go deep into the eye here. Remember, this white portion is the sclera, makes up 5/6 of the eyeball. This darker portion here we can see is the choroid, where we have all our vessels. Then deep to that we have the retina. Remember, this is the posterior segment. This is the lens. This isn't a very great model. This would be the lens there for accommodation. Remember, it splits the anterior segment and the posterior segment, where we have the vitreous humor, which gives the eyeball its shape and holds the retina in place. Then the anterior portion, where it gives the nourishes the lens and the cornea up here. What we can see from this is the iris, again, the colored portion of your eye, and the pupil, the center portion, and then the cornea up here, the translucent portion of the tunica, fibrous tunic. I think that sums up. This is the superior rectus, or inferior rectus, your inferior oblique.